Have you ever wondered how doctors identify rare conditions deep within our bodies, especially something as serious as a specific type of bone cancer? It often involves a precise and multi-step process, combining different medical tools and expert analysis. Malignant fibrous histiocytoma of bone, also known as MFH of bone, is typically identified through a combination of imaging tests, a biopsy, and careful pathological examination. This thorough approach is crucial because MFH can sometimes mimic other bone conditions, making an accurate diagnosis the first vital step toward effective treatment. The journey to identify MFH of bone begins by understanding that it is a type of primary bone cancer. This means it originates directly in the bone, rather than spreading from another part of the body. Doctors look for specific patterns and characteristics in the bone tissue. The primary mechanism for diagnosis involves visualizing the tumor with advanced imaging and then confirming its cellular makeup through a tissue sample. The reason for this rigorous process is that MFH tumors can be aggressive, so confirming their exact nature helps guide the most appropriate and timely treatment strategy. When a doctor suspects MFH of bone, they will usually start with several imaging studies. These might include X-rays, which can show abnormalities in the bone structure, followed by more detailed scans like an MRI or magnetic resonance imaging, and a CT scan or computed tomography scan. The MRI is especially good at showing the tumor's size, its exact location, and whether it has invaded surrounding soft tissues. A CT scan can provide clearer images of the bone itself and help assess if the cancer has spread to other areas. These imaging tests help physicians pinpoint the area of concern and plan the next critical step, which is the biopsy. The most definitive way to identify MFH of bone is through a biopsy. During this procedure, a small sample of the suspected tumor tissue is carefully removed. This can be done either with a needle, guided by imaging, or through a small surgical incision. Once collected, the tissue sample is sent to a specialized pathologist who examines it under a microscope. This expert looks for the unique microscopic features of MFH cells, such as their pleomorphic or varied shapes and sizes, and how they arrange themselves within the tissue. They also perform special staining techniques, like immunohistochemistry, to confirm the diagnosis and rule out other types of sarcomas. One insider detail that's important to know is that MFH was once a very common diagnosis for high-grade pleomorphic sarcomas, but modern pathology has refined this. What was once broadly classified as MFH is now often reclassified as indifferentiated pleomorphic sarcoma. However, the diagnostic approach remains similar. A combination of high-quality imaging and meticulous pathological review is essential. This detailed scrutiny ensures that each patient receives the most precise diagnosis possible, paving the way for a personalized treatment plan. Ultimately, identifying MFH of bone involves a collaborative effort between radiologists, surgeons, and pathologists, all working together to gather visual and cellular evidence. This comprehensive diagnostic pathway ensures an accurate understanding of the tumor, which empowers medical teams to develop the most effective treatment strategies and offers the best possible outcome for patients. It's a testament to how modern medicine combines technology with expert human insight to tackle complex health challenges.